Hello everyone, welcome to Tech Sharmit. In this session, we are going to discuss about another very important topics related to medical terminology suffixes, where we will learn about more suffixes that provide some information when it is used with some terminology. Okay, so we are going to proceed in the very same way. Firstly, I'll explain you what are suffix, and also we will walk through a couple of suffixes with their meaning. Along with the meaning, we will also discuss some of the examples related to that suffix, so that it would help you to learn the concept in a better way, so that if you are, let's say, in interview or in an exam, so in that situation you can easily identify the meaning of that particular medical terminology. Okay, but before we proceed further with this session, I would like to recommend you to please go and check out the previously released sessions first, because they all are in proper sequence and sync. So if you follow them sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on how to use medical terminology suffixes. Okay, alright, so let's get started. The first thing that comes in our mind is, what is suffix? Maybe some of you are not aware of it. So suffix is a word that comes in the end of the medical terminology, and from there it provides some information. So let's keep it very simple. Okay, suffix is a word that comes in the end of the medical terminology, and from there it provides some information. So in this session we will discuss some of the suffix with their information. Okay, all right. So the first suffix that we have for today is the ptosis. Okay, ptosis, which means something is related to falling or dropping, or you can say something is related to moving downwards. So if there is any medical terminology which is using this suffix ptosis, then it is always related to something falling, dropping, or downwards motion. For example, here you can see one terminology, that is gastroptosis. Gastroptosis means downward displacement of the stomach. So in some patient, if the stomach displacement occur, so in such situation, like, we will simply use the suffix ptosis with gastro, so that the complete terminology is gastroptosis and the suffix that we are using here is ptosis. Clear? So this is the one thing. Then we have second example, that is hystoptosis. Hystoptosis means proplace of the uterus. So again, this is related to ptosis, that means something is related to dropping, falling, or movement downwards. Clear? Then we have next suffix, that is rage or regic. Rage or regic. So what is rage and regic? So this is something related to bleeding or bursting forth. So if there is any situation where we have to show something related to bleeding condition, then in that case we will use this rage and regic. For example, hemorrhage. Hemorrhage means excessive or uncontrolled bleeding. So if you want to show some situation where the bleeding is in excessive and it is uncontrolled, then we will use the terminology hemorrhage, where hemorrhage is a complete medical term and rage is the suffix used there. Okay. Similarly, we have nasal hemorrhage. We also have one alternative name for this, but you can see nasal hemorrhage means medical term for nosebleed. Okay, nasal means nose and hemorrhage means condition related to bleeding. Likewise, we have hemorrhagic. Hemorrhagic means pertaining to or caused by bleeding. So if something again related to bleeding, then we will use the terminology hemorrhagic, which is a medical term, and the suffix that we are using here is regic. Next example is hemorrhagic stroke. So suppose you are in an interview and you just saw this question, what is hemorrhagic stroke? So you can firstly look into the suffix part. So suffix is indicating something is related to blood. Okay, so the meaning of this terminology is type of stroke caused by bleeding in the brain. So this is how suffix will help us to identify the actual meaning of the terminology. Clear? Fine. Now let's move to the next one, where we have the suffix as rhea. R-R-H-E-A, rhea. That means flow or discharge. So if there is any condition where we are talking about some flow, some discharge, then in that case we will use the terminology suffix as rhea. For example, diarrhea, where frequent loose or watery bowel movements are there. So this term is used for diarrhea. Likewise, we have leukorrhea. Leukorrhea means excessive flow of tears, also called epiphora. Okay, so again this is related to something related to flow or discharge, so that is why we are calling it with some suffix, that is rhea. The next suffix is sclerosis. Sclerosis means hardening. So if you want to show some situation related to hardening state, then in that case we will use sclerosis. Sclerosis. For example, nephrosclerosis, which is hardening of the small blood vessels in the kidney. Okay. Then we have hepatosclerosis, hardening of fibrosis of the liver tissue. So if something is related to liver tissue and we are showcasing the hardening of that hardening state, then we will use the terminology hepatosclerosis, and sclerosis is the suffix. Clear? Fine. Now let's move to the next one, which is SIS. This is very simple because you might already know about these terms. Like whenever you want to show something related to condition or a state, then we will use the suffix as SIS. For example, diagnosis. Diagnosis means identification of disease or condition, right? We all know that thing, that if you want to show something related to monitoring or condition, right? So in that case we will use the terminology that is diagnosis. Clear? Then we have tuberculosis. Tuberculosis means infectious disease condition caused by Mycobacterium tuberculosis. So again we are talking about the condition, and that is why we are using the terminology suffix as SIS. Likewise, we have new suffix, that is stasis. Stasis means standing still, level, unchanging. So if something related to that, then we will use the suffix stasis. For example, hemostasis. Hemostasis means stoppage of bleeding or blood flow. So here you can see we are talking about stillness. We are talking about unchanging condition. That means stoppage, the blood flow is stopped, still. Okay, that is why we are using the terminology hemostasis, where the suffix is stasis. Then we have homeostasis. Homeostasis means state of internal balance within the body. Sorry, homo, not hemo, it's homo. Homeostasis. Homeostasis means state of internal balance within the body. So again we are talking about the stillness, level and unchanging behavior. Then we have last two suffix, that is trophy and urea, where trophy is used when you want to show something related to growth, nourishment, development. For example, hypertrophy. Hypertrophy means increase in the size of an organ or tissue due to the enlargement of its cell. So here we are talking about the enlargement, development, growth, nourishment of a cell. So that is why we are using the terminology hypertrophy, where it comes with a suffix trophy. Then we have atrophy. Atrophy means decrease in the size or wasting away of body part or tissue. So that is called as atrophy. Clear? Then we have last suffix for this session, that is urea, and again it is related to urine or urinary conditions. For example, hematuria, that is presence of blood in the urine. And then we have proteinuria, that is presence of excess protein in the urine. So these are the all suffixes that we discuss in this particular session, that is ptosis, regic, rhea, sclerosis, cis, stasis, trophy and urea. In the next session we will also discuss few suffixes, but for today, like in every session there is one question, because learning all these suffixes are not that easy. You have to keep everything in your mind so that you can answer in exam. So for practice purpose, in every session I am giving you one question. So today's question is, why do we use suffix poiesis? I'm sure like most of you already know the answer of this question, so please share your knowledge in the comment section, so that if someone is not aware of this answer, they can simply refer it through the comment section. And if you have any doubt in this suffix, then you can refer the previous session. There we have already discussed it in detail. So yeah, that's all for today. See you in the next session with new topic. So thank you for watching TechSure Myth.